video. It's about an OSCE examination here in Australia. I just want to mention some of the mistakes that I have made during my OSCE examination. So like it will help you guys through the examination. Hopefully, please watch the full video and put some feedback in the comment. And hopefully this video will also help you and guide you for your OSCE examination. So number one mistake is telling everyone about your exam date. I think like for me personally, I believe in EV lies and all. And apart from that, when you tell anyone, your close friends or like your family about your upcoming exam or like examination, then I think they just keep on you asking about the exam, like how is it, how the preparation is going on, and it's just like they just have lots of expectation from you, like in terms of passing your exam, and which increases your pressure. And side by side, like you have already told your family, friends now, and you have also already worked as an RN back in home, and they expect you like you will pass it anyway. And like apart from that, exam is exam, you will of course get nervous when you are giving exam, so it just like increases your pressure when you tell everyone about it. So for me, I only believe like to tell it once I passed the exam or once I've done it. Okay, so mistake number two is not going through the manual. So even though if you have joined an institute, I think they're of course going to help you and guide you through like what is an OSCE, what kind of like situation are there, what are the clinical skills you will need. But apart from that, I think you should also learn through the OSCE manual, which is given by the board itself. So when you pass the NCLEX, when you get the invitation for the OSCE examination, then usually it's attached in that email box. But if you are non-examiner and like thinking about how I can check on the manual, and then you can go under the Australian Midwifery and Nursing Board. So under there you can go in the international section where you will see the examination like thing, and under the examination section you can find the OSCE manual handbook 2000, like whichever is the latest one. So I can also put the picture in here. So these handbooks includes like any kind of tips before giving an exam and after giving exam, and of course how to cancel your exam, any standards, policies that you will need to follow, and also like it will give you the overview of what kind of skills you will need, like communication skills or any other clinical skills that you will need. So everything will be included in this handbook. So make sure you go through each and every section of the handbook before you like book your examination, or even you after, like before giving an examination, at least I think you should go through the book. Okay guys, those were some glimpses of the manual handbook. I think like I said, you can go into Google and then go in the internationally qualified nurses and midwifery section, where you will see the examination section under which you can get those manual handbook. So yeah, make sure you go through the manual. Yeah. Some fear and nervous, I won't say it as a mistake, but I think it's like common. When you have an exam, you will of course get nervous and you have this fear on you, like, but what I want to suggest is don't forget that you have completed your bachelor's, like you have gone through all those hard times when you were studying for the bachelor's, and when you have also already gained the experiences and the clinical skills when you worked in your home country. So don't forget about this thing. It will help you to boost your confidence. So when you get nervous, it will create just like communication difficulty with the simulated patient or like dummies in your exam hall. So try to be calm and like try to like go through all the skill set that you will need, so the nervousness will also reduce. So another mistake is not preparing your dialogues. So when you prepare your dialogues, it helps to go like the whole procedure very smoothly, without any leaving any gaps or any without forgetting any steps in between. So what happens when, like, if you have any clinicals that you're gonna do, if you know your introduction part, and you won't forget about taking consent, providing privacy, and then next preparing your body where you do your actual clinical set, and giving the conclusion of whole the procedure, then it will definitely help to reduce your nervousness as well and reduce your fear. So make sure like you prepare your dialogue when you are preparing for a station, and make sure it's similar in all kind of station where it can be implemented. So like there won't be any mix matching, and there won't be any gap when you are doing any clinical skill, and there won't be any missing steps when you do it as well. So I think this part is very important. So another mistake is not observing yourself. It means like not identifying and assessing yourself and identify your weakness or areas to be improved. So what I suggest, when you practice the clinical skill, record yourself and go through the video and find out what kind of mistakes or areas to be improved are there in your video, like any non-verbal cues such as facial expression, any hand gestures that you are doing, and your body language. So I think these are very important part in your examination, as it is counted as non-verbal communication. So make sure you observe yourself and find out your weakness and your communication flow, or any gaps or any steps or any your body language. So it will help you to gain more confidence, and it will help you in to complete your whole skill set with everything in. So other thing, when you prepare your dialogue, it will also help to complete the whole skill set in a given time period. So you won't have to think about the words or any phrases that you're going to use when you are doing any scenarios. So when you're actually prepared with all those dialogues, then it will just there will be no gap. I would say there will be no time for you to think, like give the words like and then that there's very time limitation in this OSCE. So I think it will definitely help you with your time saving as well. Okay, so now let's talk about the exam day mistake, which is very common. I think trying to learn new things. So when you reach in the exam hall, you'll definitely gonna meet the different nurses who are from different countries, and then they will have their own skill set, or when they have their own ways of doing their things. So don't get distracted, and don't try to learn how they are doing their things or their communication way or any skills until and unless you practice the thing that you have practiced is 100% incorrect. Then you can adopt their skill set at that time. But if you are going in good direction and you don't need to modify your one practical set, so don't do it until and unless it's needed, because I think you're just gonna mix match your skill with their skill, and which is just gonna create the confusion when you're doing the examination. So just stay focused on your one practice skill or set that you have practiced at your home. So losing calm and confidence, it's another factor. I know it's gonna happen to anyone. For me, it happened with me. I was so nervous. I was just pacing here and there when I was giving when I reached the exam hall. So what I suggest is go day before your exam and go around your exam center area. Of course, you are not allowed to go inside, but you can see from outside how your exam hall or how your center looks like, and then be calm, drink water, and then they will give you instruction everything inside when you go in there, about the exam hall and all. So don't get nervous. Just believe in yourself, I would say, and believe in whatever you have practiced, and of course you're gonna nail it. So thinking about completed station or upcoming station, Oh my god, this is the worst thing to happen to anyone in there. So once you give exam and when you come out of that station, of course you're gonna go through like how your station went, right? So you're gonna remember like we are like, oh my god, I forgot to do this thing inside there. Oh my god, I'm gonna fail now, or something like that, or whatever you have forgotten, or whatever you have talked with your patient. Like if you haven't if you have made any mistakes, just let it go and don't think about that station. When you go to another station, just think about the current station, because it happens to a lot of nurses. They just go in the another station and started to think about the old station where they missed the things, and then on the way, like when you are going through that station questions and all, you will forget to you will get distracted a lot and you won't be able to focus. And of course, like you only have 2 minutes to read your questions, in that scenario, in that station. So your 2 minutes will be gone like this, in a blink of an eye, and then you won't have time to read the whole question, and then you will get more nervous when you go inside, and you will mess up with that station as well. And also thinking about another station. So once you come out of that station, don't think about like what's gonna be next, or don't try to talk or try to communicate with another person who just came out of that station, or don't look at their facial expression, because you will get more nervous. You will think, oh my god, her expression is so bad, maybe that station is really hard or something like that, and you will again lose your calm and get nervous. So just think about the current station that you are gonna go in. Don't think about before and after. So just go with the flow, okay? I'm telling about this thing because it actually happened with me. So in the first station, I was very nervous. I wasn't I just thought the question is only half, and I didn't bother to scroll it down. And then later on I found out I think 15 seconds before, I just found out there are more questions to read in that station. Oh my god. And then I didn't even had time to read all those questions, so I just went in. I had no choice. I just went in. I just did my station. I came back. I was all red. I was all nervous, and I was so bad. I was thinking about the station and the second station as well. And then at that point, I just thought okay, let it be. It's just first station. I'm not gonna mess up with my second station. So I just totally forget. I just totally switched it off, So I think it's very important for you guys to understand this, okay? And I will also tell you another funny story. And when we reached in the half of the station, I think we have already completed 3 or 4, and then I saw another nurse coming out crying from that station, and I was like, and that was my next station. And when she came out crying out, I was like, oh no, now it's me, my turn. Why is she crying? What happened in there? Is the exam is the scenario that hard, or did something happen inside? Is there anything that's gonna bother me? Something like that. And I was thinking about that thing when she came out crying. And of course everyone will be in shock when someone comes out crying. That's why I'm telling you guys, don't think about the past and don't think about the future station. Just focus on your current station, okay? And I'm telling you guys, it was not funny when I was in that situation, but now when I think about it, I can say it was funny, the way I was reacting. So yeah, I think I learned a lot from that situation, okay? So another mistake, guys, don't get task oriented and time oriented. Don't forget, when you get task and time oriented, you forget to acknowledge your patient. You forget to establish the rapport with your patient. You forget to give the non-verbal cues like smiles, greeting your patient or something like that. And just remember, when you're getting things done doesn't mean that you're gonna pass the OSCE. There are so many criteria that they're gonna observe. So I think like I said previously, establishing rapport, acknowledging your patient feelings, and good communication and good non-verbal communication cues are also other criteria that they're gonna check on you, or they are gonna mark on you. So make sure you're not just task oriented and time oriented. Alright guys, we are at the end of the video. Hopefully you have learned something from my mistakes that I have made during my OSCE examination, and hopefully you guys won't repeat it. If there are any other mistakes or any other things that needs to be considered during this examination, you can put down in the comment box. And thank you for watching the video. I will come back with another new video very soon. Thank you guys. Bye.